Hi, I'm Dr. Paul Oakley. I'm going to answer the question, what is scoliosis? Scoliosis, here's a model of the spine here. Scoliosis, by definition, is having a curvature of the spine from the front view of at least 10 degrees or greater. And what happens is also when you have curvature like this, it causes rotation of the individual vertebra. So a curvature of at least 10 degrees with rotational aspects with this, that's called scoliosis. You know, the dangers of scoliosis is that if a child has scoliosis and they go through a growth spurt, a lot of height growth in a short amount of time, the magnitude or extent of the curvature can get worse very, very quickly. And what tends to happen is if the curvature gets 40, 50 degrees or greater, then often surgery is recommended where they will go in and attempt to straighten the spine as much as possible and literally put rods in the back. What basically happens is it just changes a curved flexible spine into a rigid straighter spine. Why the spine is important in the first place, of course, is that the spine houses the central nervous system. The nervous system is your body's computer. Whenever you have bad posture, including scoliosis, it can compromise the normal functioning of the spine and therefore put stress, strain, and pressure and pinching onto the nerves, which can cause bodily symptoms of all sorts of things, including pain. Also, what happens over time is that the spine, this is what a healthy spine looks like, two individual bones here with the disc in between. The disc should be, equal in height to the ones above and below it, and also that provides for a good amount of space where the nerve comes off the spinal cord, and this nerve goes, the nerves go everywhere, to all parts of the body all the time. And it allows for good movement. There's not a lot, but there's not supposed to be, but the combination of the addition of movements at each level allows for a great range of motion and normal flexibility that the spine should have. If you have bad posture or scoliosis over time, the extra pressure is going to cause spinal arthritis to ensue. What happens is that you can see in what we call phase 1 here, there's extra pressure onto the disc, and this may or may not cause pain at this point. Further years down into the future, what happens is now we can actually see on X-ray degeneration occurring. So what these are arthritic bone spurs. You can see the disc space is getting more narrow. Oftentimes it causes disc herniation or bulges, which can definitely pinch nerves and cause excruciating pain in a lot of cases. And worst case scenario is when the bones can actually fuse together completely, pinch the nerve off, causing all sorts of bodily symptoms, and there's like no movement anymore. So the main goal for anybody with scoliosis obviously would be to stabilize that, to not let it get worse first of all, because worst case scenario continues to get worse into your early teens, and then you have, a lot of times you might have to get surgery if it's bad enough. However, there are so-called alternative options, namely the scoliosis spine core brace, which can be very effective in not only stabilizing the spine and preventing surgery, but actually getting a lot of correction into the spine. So in adults, we want to stabilize the spine and relieve back pains, but in children, the brace is very effective for providing a lot of correction and avoiding surgery. So I'll briefly show you the brace, and that is this right here. This is the spine core brace, and I have another video that describes in more detail of how this brace works and how often it would be worn. So I hope that answers the question of what is scoliosis. Thank you.